An estimated 550,000 Canadians have viral hepatitis C and don't even know it. That's why public health is urging everyone to know their hepatitis status.
And the one thing we can do is our civic responsibility, just as we know what our HIV status is, just as we go and have our annual flu shots, is to know what is my hepatitis C status. Why? Because we don't want to be an unnecessary burden on the system, because you can develop cancer of the liver, and lo and behold, there is treatment for it.
The rates of hepatitis C in Saskatchewan are double the national average and projected to rise. Today, the Chief Medical Health Officer of the health region says the public needs to understand how the virus is transmitted to help reduce the spread of the disease.
Yes, well, we all go and get tattoos, or we all go and get piercings. Sometimes the same instruments are used, yet you don't know what the other person's hepatitis C status is. You can also get it, say for instance, you have traveled overseas or you've traveled out of town and you happen to have to receive, say, a blood transfusion.
The clinic at 101 5th Street East offers confidential testing for HIV, STDs, and hepatitis C.
Testing for hepatitis C is extremely easy. It's just a matter of taking blood from the arm. What we would be testing for is an actual antibody test. When people come back with a negative Hep C antibody test, what that means is that they have never been exposed to the virus. They do not have hepatitis C. For clients who come back with a positive antibody test, that means at some point in their life they were actually exposed to the hepatitis C virus.
They also offer a safe, unbiased environment for people seeking treatment or needing counseling.
I would explain it as being calm, very non-judgmental, friendly. Stigma is not really tolerated here. We come from a harm reduction point of view, not a judgmental point of view.
The number one method of transmission remains intravenous drug use. Dr. Chikami urges people who engage in risky behaviors to take measures to protect themselves.
Where people share the needles, that's the problem. Okay, it's not that they inject themselves, it's that I use it and I pass it on to you. That's the problem.
Hepatitis C doesn't usually cause an acute infection immediately after exposure. That's why so many people may carry the virus and not even know it.
It's blood transfusions, you get organ transplants. If, for instance, you have been, say, vigorously brushing your teeth and there is going to be some blood and you go and you, say, have a sexual contact with another person and there's that exchange of blood, again, yes, you can pick it up, especially if that person has got it.
There is no vaccine for hepatitis C. It's a chronic condition that causes inflammation of the liver. 25% of healthy patients are able to clear the virus on their own. And there are drugs available to help put the virus into remission. For Shaw, I'm Lisa Risom.